Hello and welcome to Healthcare 4630 Module 10. The portfolio assignment is The Model by Rob Hernandez. Today is August 25th, 2020. Let's begin by talking about predictive analytics. And predictive analytics is broadly defined as a variety of techniques that predict future outcomes. It predicts future outcomes based on current and historical data, and it captures patterns and relationships in the data, and it likes big data. Predictive analytics, what it is not. Predictive analytics is not one size fits all. It is not fortune telling, and it's not always correct because data can change rapidly. Consider all the data coming in from COVID-19 and the virus. What is true today and correct today may not be true or correct tomorrow based on the data. Let's talk about big data for a minute. Predictive analytics likes big data and it requires vast amounts of data, and some people define the two as being one together. But predictive analytics in healthcare is a little bit more detailed than that. Let's take a look at predictive analytics in healthcare. It's sensitive and it's critical because healthcare data is critical and sensitive. So healthcare data is complex, so we want to be careful to choose the topics that we are trying to predict. So this leads us to thinking about prescriptive analytics. Prescriptive analytics is used for healthcare, and it's predicted data used in a patient plan of care, and it must be used ethically because there are privacy laws that vary from state to state and that are federal, so you need to consider those. How does this apply, for example, in an emergency room? Let's say you have an emergency room that wants to consider claims data to predict hospital readmissions within 30 days. Well, there are mechanized algorithms that can determine top reasons that are shared by patients who are readmitted within 30 days, and electronic health records can be data mined to identify patients who are at risk for readmission within 30 days. All right, so you know that. What's the next step? Well, registered nurse home visits. The registered nurse home visit is for prevention. So 1 week after discharge, there would be a follow-up visit by the registered nurse for patients who have been identified at risk for readmission. This applies the concept of prescriptive analytics and also shows how DIK. So thank you for listening, and here are the references that were used to create this video.